Hi, I'm Heather. I'm one of the nurses at the U of R Home Infusion Pharmacy, and today I'm going to show you how to administer TPN through a PICC line. So the TPN has to go in the refrigerator to be stored, and you're going to take it out about 2 to 3 hours before the hookup, and you want it to come to room temperature before you hook this up to the patient. You're going to just inspect the bag. You don't want any bubbles in it or any particles floating, any oil looking marks in there. Little champagne-sized bubbles are okay, but not big ones. So you want to make sure that that looks good. Let that sit on the counter for the 2 to 3 hours. You're also going to grab a couple multivitamins out of the refrigerator. You're going to have a box with a set of about 6 of these, and you're going to grab one that has a white top and one that has the purple top. And you're going to set those out as well. When you're ready to do the hookup, you're going to wash your hands real good with soap and water, about 60 seconds, and use a paper towel to dry your hands. And then we're going to get started. So what we're going to do first is we're going to get the multivitamins into your TPN bag. So we're going to pull this foil piece off of the end. We're going to take an alcohol pad, and we're just going to scrub the place where we're going to put the needle into. So we're going to give that a good 15-second scrub. And then we're just going to use this alcohol pad just to set underneath there so it doesn't touch the table. Next thing we're going to do is we're going to take the caps off of the multivitamins. And then we're going to use an alcohol pad for each vial. So we're going to scrub the tops of those, 15 seconds. And discard that and grab another alcohol pad and scrub the next top. So now we're ready to open up the syringe with a needle on it. I'm just going to peel that apart. We're just going to tighten this needle because sometimes they're a little loose. We're going to pull down to 5 mLs. So the plunger should be right at the 5. We're going to take the cap off. We're going to poke that into the vial. And you're going to push that air in. Release that and it'll fill it. So your needle's going to be longer than what's inside the vial, so you're going to have to pull the syringe down so that the needle comes out a little more so we can get all the contents. We should have about 5 mLs when we're done pulling that out. Okay. And now we're going to pull this plunger down to the 10 to get some more air in there, and we're going to put that into the next vial. Push that air in, and then you can just release that plunger and let it pull down. And you'll do the same with this and pull that needle down a little bit so that we can get all of that in there. So you should have 10 altogether. Now this is going to go into that part that you just cleaned. So straight in. You want to make sure you go straight in, or else you'll puncture the bag and it'll leak all over the place. We're going to slowly push this into the bag. Now if you have some air, so when you're pulling the multivitamin into the syringe and you have some air at the top, you can kind of flick the syringe a little bit and push the air out and then put it into the bag. So this we're going to put the cap back on, and this is going to go into a sharps bucket. All right, we got our multivitamins in, so we're just going to kind of rock the bag just to mix it. You don't want to shake it real hard and put more bubbles in there. All right, so next thing we're going to do is get the tubing. So you're going to get a couple tubings depending on your TPN. Sometimes you'll get some white bags, sometimes you'll get all white ones. So there's different tubing for each bag. So the clear bags have a label on it. So if it's just clear liquid, you'll use this. And if it's the whitish one with the fats in it, we're going to use this one that says to use this one for the white bag. All right, so we're going to open this up. insert. There's some paper tape here. We're just going to rip this off. Okay, so there's this addition inside the package, and this is going to go on the, it's going to replace the blue cap. So we're just going to open this up. And both sides have caps, so you're okay touching these. So we're going to remove the white piece, just twist that. And then we're going to twist the blue piece off, and we're going to attach this here. Now there's a flow restrictor thing here that we're going to remove from there. So that's a quick release tab. We're just going to twist that off. Okay, so let's spike the bag. So to spike the bag, we're going to open up our tubing. This is the spike end. And if you straighten this all out, you're going to find the end that goes onto the PICC line. I can set this down because I have a cap on it. I'm going to remove this piece here. This is where the tubing is going to go. So we're just going to twist this. And then we're going to take the cap off of here. Just remember that the cap is a sterile piece underneath it. I'm just going to bring this over the edge of my table so it doesn't touch the table, and take my cap off. And then I'm going to grab this and push this and give it some twists and push until it's in there. You'll notice that the probe goes through that hard plastic piece. You know that it's in there far enough. All right, so now let's put the batteries into the pump. The batteries are back here. We're just gonna shift this to the unlock. And we're gonna put the 2C batteries in. And then put the cap back on. And lock. Okay, it says open to lift. Or lift to open. We're going to open that up and pull that open. So on the inside of your pump, you're going to see a couple colors. On this side, there's a blue arrow. If you could turn it. You see it? Mm-hmm. And on this side, you're going to find a yellow dot. So that's going to correspond with the colors that are on the tubing. So we have blue and yellow. I'm going to put them into the pump. I'm just going to lay it on its side because it's easier to put the blue piece in there. So we're going to put that in the blue square. And you want it so that the tubing is in this opening, because that's where the opening is for the tubing. If it's on the other side, it'll puncture the tubing. Okay, and then we're going to put this over here. And this is going to set right in this groove here. It doesn't click, but you'll feel it set into that place. Okay, our tubing is in. We're going to close it and clamp. Now I'm going to turn it on, because what we need to do is we need to prime the tubing. We need to get the medication to the very end of the tubing. So let's turn it on. And what you're going to find is it goes through its system checks. As your battery life. Okay, so now it comes to this place and it stops. It says enter to select. It's already highlighted on program, and that's what we want. So we're gonna hit the yes button. When you do a new bag, so you're doing a new TPN bag, the repeat is the option that we want because it's a new prescription. So yes, and this is TPN. So this is going to go through and scroll what the pharmacy has provided for you for your prescription. You don't have to change this. This is just going through the system. And now we have a bunch of options. And what we want to do is prime the tubing before we hook up. Your prime button is down here. I'm going to hit that once. And now I'm going to hold it down, and you'll hear it start to pull the fluid. This tubing has a filter on it, and it's shaped like an arrow, and that's how you want to hold this until that filter fills. Once that filter has all the TPN in it, it starts to go down the other end, then you can set that down. So it's starting to go down towards the end of our tubing. And now once it gets to the top here, we're going to release the button. Okay, so that's our stop point. So with this, this pump has a safety feature on it. In 30 seconds, if you don't hit start, it's gonna beep at us. So I'm just gonna leave it on so you can hear that beep. But at this point, we're gonna get this into our backpack that you have for carrying the TPN. Alright, so this backpack is meant for a large bag, similar to the one that you'll have. This is a little bit smaller than what you'll have at home. Lots of Velcro. So we're just going to kind of put this Velcro through here so that we can bring it up and hold it in one spot. I'm just going to fold that over. And then you're going to fold this like this. And then these things kind of support the bag because it is pretty heavy. It goes up in between there. So there's our alarm. I'm going to hit pause just to stop it from beeping. Over here is where we put the pump. There is a little peekaboo window on the other side of our pouch so that we can see the pump if it starts to alarm without taking the whole bag apart. So this is going to go backwards and upside down. We're going to put this way down here. I'm going to fold that up over. And that, and that, and then there's also a little buttonhole that we can put our tubing through on the outside of this bag. Okay, so now I'm just going to keep the rest of this tubing in, and you can push in and take out as much as you need if you need more tubing or less. And then we're going to zip this up. So now our TPN is all ready to go, and now we're going to get the line ready on the PICC line. I'm going to use this arm here. We're going to need one saline to flush, so I'm going to open that up. And I'm also going to need an alcohol pad. So I'm going to take the orange cap off of the end of the PICC line and discard that and give this a good 15-second scrub. Now I'm going to open the cap. Sometimes if you put this between your fingers, you have all use of your fingers. I'm going to pull down just to release the plunger, and then I'm going to push that air bubble out of there. And then I'm going to push and twist this onto the end and open up my clamps. And then I'm going to do a push pause. Nice hard push stop to help clean the insides of those lines. I'm going to take that off, and I'm going to scrub again, each time using a new pad. And every time it's 15 seconds. Okay, now we're ready to hook up the TPN, so I'm going to take my piece here. We're going to twist this cap off. And then push and twist that onto the end. Our clamps are open. So now we're ready to start the pump. Because I push pause, it brings me back to the screen again. So I'm going to do yes. And TPN. It's going to go through the settings again. Now I'm going to hit run because I want to start the pump. So that's running. You're going to see the green light flash while it's on. This is going to tend to go a little bit darker because it saves the battery life a little bit, but it is still processing what it's infusing. At any time, if you want to check your battery life or just want to see, what is going on that screen, you can hit the number 2. It'll give you your battery life, and it'll also light the screen up for you. If you have an issue where your pump is alarming, then you're going to have to fix it, because if you don't fix the alarm, then it will stop your infusion and you won't get your TPN. We're going to give you a booklet that has some troubleshooting guides on it, and that you're going to follow along in the back of the book and troubleshoot what the screen is telling you to do. Otherwise, your pump is functioning fine. We're just going to let that hang out for the 12 hours, and then when your infusion is complete, it's going to tell you it's complete, and then you're going to get your morning flushes ready. So I'm going to pretend that it's been 12 hours. My pump says I'm done, so I'm going to hit the pause and then the off button, and that's going to turn the pump off. I'm going to wash my hands again, soap and water, wash my area down that I'm going to be working on, and I'm going to open up my flushes. So in the morning, you're going to flush your line with 2 salines first, and then you're going to follow it with a heparin. And the heparin is a blood thinner that helps keep the line clean and help from preventing clotting. I'm going to get those out. I'm going to clamp the line, and then I'm going to take this off of the end. So that will all be garbage, so you can just set that over there. Take my first alcohol pad and scrub. Okay. Again, I'm going to put my PICC line there so I can use all of my fingers. Twist the cap off, pull down, and then push the air out. Push in. I'm going to open up my clamp and do that push, stop, push, stop. All right. I'm going to clean with another alcohol pad. So every time I disconnect something, I'm cleaning with alcohol pads. Pull down, push the air out, oops. And push stop. Okay. And one more alcohol. Last thing is the heparin. I'm going to pull down on that one. You're going to find it's a little harder to pull that one. And then get the air out of that one as well. And we're going to push that in. And when you get to your last push, we're going to clamp. Okay, now every time you have to recap your end of your PICC line when you're done, you use a new alcohol cap. I'm just going to reuse this one because I don't have an extra. And there we go. So that's it for that. So when you're all done with this stuff, you're just going to take this all out of the bag, discard the empty bag, take the batteries out of your pump because you're going to put new ones in before you start it again in the evening. And that is it.